Dengue is a viral disease transmitted to humans through the bite of the infected Aedes mosquito. In Pakistan, it has become a significant public health problem, particularly during and after the monsoon season. The disease presents itself with symptoms such as high fever, severe headache, muscle and joint pains, and in severe cases, it can lead to bleeding, shock, and even death. The impact of dengue in Pakistan is substantial. Thousands of cases are reported each year, placing heavy pressure on hospitals, healthcare workers, and blood banks. For example, Pakistan reported over 52,000 cases of dengue in the year 2019 alone, showing the scale of the problem.
Several factors contribute to its spread, including rapid urbanization, poor sanitation, and stagnant clean water, monsoon rains, and the limited public awareness about the prevention. Densely populated urban areas are particularly vulnerable. Discussing the dengue fever is important because it is preventable. Public awareness, early medical care, and effective mosquito control can significantly reduce the illness, deaths, and the overall burden on the healthcare system.
For this documentary, we combined research with fieldwork. We reviewed articles and studies to understand dengue scientifically, created and distributed awareness brochures, interviewed doctors to gain clinical insights. This approach allowed us to present accurate information alongside real experiences from both patients and healthcare professionals.
We then visited Jinnah Hospital, Lahore to gain further knowledge into the dengue fever, its causes, symptoms, and effects.
I'm Yasoob Ali Khan.
I'm Zayan Adil.
I'm Zaafir Mubeen.
I am Hashir Qureshi, and our group is here today at Jinnah Hospital to interview specialist doctors and dengue patients to gain first-hand clinical insight into the dengue fever.
I am Professor Dr. Nigat Majid. I am Professor of Medicine at Allama Iqbal Medical College, Jinnah Hospital, Lahore.
This is Dr. Abdurrahman Khalid. I am an ACFMG certified doctor currently serving as a house officer in Medical Unit 3 of Jinnah Hospital, Lahore.
My name is Dr. Shazib. I have recently cleared my USMLE. I'm an ECFMG certified doctor.
We asked some questions regarding dengue. Question number 1. In your opinion, why is dengue fever still predominant in Pakistan?
I think the most important reason is since we are a developing country, we are resource limited, and there is a prevalence of slums, and slums basically provide a breeding ground for the mosquito of dengue. At the same time, although people have been counseled regarding cleaning the water in their sewerage pipes and stuff, people still don't care a lot.
One is the lack of the awareness among the people. After the rainy seasons, they don't let the stagnant water drain. Especially in the rural areas, rainy water at times gets stagnated after the heavy rain falls. And the high population growth rate in Pakistan is one of the factor, and it leads to the sharing of the healthcare facilities among many people, and at times get the problem worsened.
Question number 2. What symptoms should we look out for as early indicators of this disease?
One most common symptom they present with is retroorbital pain. Patient says that I am feeling severe pain behind my eye. Other than this, the symptoms include GI symptoms. They are vomiting, they are dehydrated, they have diarrhea. The most common symptom is fatigue. They feel tired all the time, and then the symptoms slowly progress towards the elevated fever. Then it proceeds towards a rash. When the platelets counts are decreased below a certain number, they start developing PK868 on their body. PK868 basically are pinpoint hemorrhages throughout the body.
The most important symptom at the beginning of the disease is fever. A lot of fever spikes that the patient has, and body-wide aches. So aches all over the body, and especially one very important symptom is retroorbital pain. Retroorbital pain, in simple words, would be pain behind the eyes. That is a very important symptom of dengue, and if anybody has the symptom, they should immediately see a doctor. Other than that, some other symptoms which might be severe include epistaxis, which is bleeding from the nose, or spots on the body, which we call petechiae, but they occur later in the course of the disease.
Question number 3. Do you think our local hospitals are sufficiently equipped to handle dengue patients properly?
Most of the hospitals in our tertiary care setting are well equipped to manage dengue cases. But in case of outbreaks, and when the triage system shows you that there are a lot of high-risk patients, or the patients who are having their second attack, then they can go into a condition known as dengue hemorrhagic fever. In that case, we need ICU. Number of beds in ICU in our settings are very limited. All the hospitals in Punjab particularly, they are better than other provinces, but ICU beds need to be improved.
Okay, so tertiary hospitals are well equipped to deal with cases of dengue. We can deal with a number of symptoms of dengue concerning a number of bodily systems. Our primary healthcare setups, including the BHUs, the RSCs, they are not well equipped to deal with cases of dengue, unfortunately, and people, especially from villages, if they catch or contract dengue virus, there is a very high chance for mortality. If we compare the condition nowadays to a few years back, the condition is a lot better, but obviously there is always a room for improvement.
Question number 4. What do you think the government and local authorities can do to make the situation of dengue better in Pakistan?
The promotion and the fixing the drainage and the infrastructure, especially after the heavy rainfalls and in the residential areas, is required in this case, because the dengue larva is at times difficult to pick, and the local germicidal activities can be done at the spot, and public education definitely is the key to success.
What government need to do is that they need to improve the sanitation, spread public awareness through social media. In case of outbreaks, there should be sufficient availability of CBC vials and all the stuff that is needed to treat the patient. The most important thing is early response of medical personnel. We need to develop a triad system so that we can mark the patient which are high risk and which are low risk and give them sufficient treatment.
As we continued our journey, we visited a ward and also interviewed a patient to know their experience throughout dengue.
अस्सलाम वालेकुम।
वालेकुम अस्सलाम।
आपकी कैसी तबीयत है?
जी बेहतर है पहले से।
आपको डेंगू कब हुआ?
मुझे तकरीबन 4 दिन से बुखार है, लेकिन डॉक्टर के मुताबिक मुझे डेंगू बुखार है।
आपको पता है कि डेंगू का मर्ज मच्छर के काटने से फैलता है?
जी मुझे मालूम है।
तो आपके घर के इलाके के अंदर काफ़ी ज़्यादा मच्छर पाए जाते हैं?
जी मेरे घर में काफ़ी मच्छर है।
तो आप आवाम के लिए क्या पैगाम देना चाहेंगे?
आवाम से यही कहना चाहूँगी कि डेंगू बुखार एक बहुत बुरी बीमारी है, लिहाजा ख़ुद को मच्छर से बचाएँ और अपने घर में मच्छर से बचाव के स्प्रे वगैरह करें।
We distributed our brochures and posted them in public places to create awareness among people. Additionally, we organized seminars within our school to expand the reach of our campaign. During these sessions, we presented our findings along with selected clips from our documentary. Students were requested to complete a survey form to help evaluate the effectiveness of our campaign. We also invite viewers to kindly fill out the survey form and share their valuable suggestions.
And mosquito control are critical to reducing illness and saving lives.
Okay, as you can see, here we have also added the statistical data regarding the increasing trend of dengue in Pakistan. As you can see, over the course of the years, and around in 2020, around 50,000 cases were reported.
So these are the precautions to prevent the dengue disease from spreading. First one is to remove or cover stagnant water to prevent the dengue mosquitoes from breeding. Secondly, wear long sleeves and use mosquito repellents to prevent the dengue mosquito from stinging.
Results indicate that our documentary was effective in raising awareness, clarifying key concepts, and highlighting the severity of dengue in Pakistan. It also enhanced participants' understanding of its symptoms and preventive measures, particularly through the distribution and explanation of brochures. These results will be included as evidence of our actions to demonstrate the effectiveness and overall impact of the campaign. We showed our research to a credible expert to gain remarks regarding our dengue campaign.
Hello, myself Akmal and I'm an educationist. This project was significant because it actually created awareness for dengue, and especially like countries like Pakistan where there is very little to none awareness and education available considering the health sector. This was such a I would say this was such a great step they have taken, such a great initiative they have done, that they reached to the community. They made people aware with the fact that dengue is a preventable disease and what basic and grassroots level measures can be taken to eradicate the alert or the alarm of dengue. I wish them a very good luck ahead.